Skin cancer is the most common of all the cancers, but if it's diagnosed and treated early, it can also be one of the easiest to cure. The Soderstrom Skin Institute is offering free cancer screenings this Saturday, and board-certified dermatologist Carl Soderstrom is here with more on why those screenings are so important. Welcome back to Living Well.
Well, thank you for having me back. I'll tell you, we've been busy since last year, too, when we were here, and we saw 3,600 and some skin cancers in the last 12 months. And I wanted to come back and let the public know and you that we're very grateful for the screenings and for people coming in. Because of those, 276 were malignant melanomas.
Wow.
And that's about, you know, almost like one a day practically that we see. And we have 8 clinics now around Central Illinois and Iowa. And this is a very serious problem. It's a worldwide epidemic, basically. And when you find a melanoma early, you can operate on it, treat it, and cure it. When it goes a little too far, we have newer treatments, but we still have a lot of fatalities from that type of cancer. So it's a serious one, and we take it seriously, and we're glad to do these screenings and glad to let people know about it.
Well, we appreciate you offering them throughout the Central Illinois community for free. Can you give us a sense of whether or not we're getting better or worse? Are you seeing more or less of these cases?
Well, you know, I don't have an explanation for it because we've been doing this for 30 or 40 years now to educate the public, but we're seeing about a 25–30% increase over the year before last year, and we're starting out the same way this year. There's a huge number of skin cancers that are coming in, and patients are seeing spots that are changing. We've seen big ones. We've had to do lots of large surgery on some patients who've waited too long. You know, whether it's genetics that are getting loose in people's bodies, or whether it's too much sun and it's been catching up with people over the decades, or just what the reason is, there's just a tremendous number, more so than what anyone can really explain.
So let's talk about risk factors. How would somebody know if they're more or less likely?
Well, people that are out in the sun, light-complected, upper European or Swedish people, light-complected, and people who work in the sun, play in the sun, golfing, farming, fishing, that sort of patient is very susceptible.
So what kind of preventative measures can they take?
Well, we like to tell people to avoid the hot midday sun, use a sunscreen, and put it on every 2 or 3 hours because it does wear off. Wear protective clothing, wide-brimmed hats, long-sleeve shirts and blouses when you're out working in the garden. And also, I think that it's really important that we look at our family history. And we've noticed, the studies show that when one person in a family has a melanoma or skin cancer, other people may develop one. So there's some genetic tests now that are starting to become standardized, where you can test your genetic susceptibility to developing a skin cancer, sometimes even without any of the risk factors, just because you are who you are genetically.
And what are some of the signs that you have it?
Well, if you have a mole or a spot on your body that's changing, if it's getting bigger or darker or bleeding or evolving, changing color, these are the kinds of things we look for. Usually they're black, but sometimes they're red or white, and they're just a changing area that seems to be getting bigger. Itching, stinging, that sort of thing. So if people have a spot, you know, we say if you can spot it, you can stop it. So if you have a spot that's unusual, and this helps us a lot because people come in and say, oh, I spotted this. Well, that's better than saying, I don't know if I have anything. We got to check your whole body. It's really helpful when people say, oh my gosh, my spouse discovered this on my back or my arm, and then we can focus on it.
So let's let folks know how they can come and take advantage of the screening and make sure they are okay too. The Soderstrom Skin Institute is offering a free skin cancer screening Saturday, May 18th from 8 until noon at their Glen Park Place location in Peoria. Call 674-SKIN for more information. Doctor, thank you so much for being with us.